Hi everyone, my name is Colin Murphy, and I'm here today to discuss Black maternal mortality in the United States from the perspective of developing interventions as a public health nurse. So to begin with defining the problem, in the United States, Black women face significantly higher maternal mortality risk than white women and women of other races. More specifically, the maternal mortality rate is 3.5 times greater among Black women than white women. Disparities are concentrated among a few causes of death. Postpartum cardiomyopathy and preeclampsia and eclampsia are the leading causes of death for Black mothers, with mortality rates 5 times higher than white women. Black women are also 2 to 3 times more likely to die from hemorrhage or embolism. Taking a look at social determinants of health and Black maternal mortality, the problem can be defined in the context of the social determinants of health, which are all impacted by systemic racism. The social determinants of health: economic stability, healthcare access and quality, social and community context, education access and quality, and neighborhood-built environment. These all contribute to this health issue because racism touches all aspects of social determinants of health through unequal access. So if someone has unequal access to proper education, they lack the knowledge when it comes to maternity and pregnancy and childbirth, similar to the neighborhood and built environment perspective. If someone lives in a predominantly Black community, then they are more likely to deliver at a Black serving hospital, which has been studied and shown to show worse maternal outcomes. Moving on to the socioecological model and looking at each level and what helps and what hinders the problem at each. The individual level, education is key. So if someone is more knowledgeable about things like alcohol use and how it is associated with negative pregnancy outcomes, then there's more likelihood that the mother would not consume alcohol during pregnancy. A hindrance of this is that the opposite is also true. If someone lacks knowledge or education, then the more likelihood of alcohol use during pregnancy. At the interpersonal level, strong social support is beneficial for the mental health of low-income mothers, but also at the interpersonal level, we see how implicit bias among healthcare providers can impact outcomes. At the organizational level, things that help: organizations like the National Birth Equity Collaborative that have a goal of creating tools and supporting infrastructure to support better outcomes with respect to maternity care. A hindrance is quality of care in hospitals serving predominantly Black women. They have a higher mortality rate than non-Black serving hospitals, as I discussed when it came to the social determinants of health. Community level, there was an announcement from the Department of Health and Human Services to create a maternal and infant collaborative among 200 hospitals focused on improving maternal and infant health outcomes by reducing disparities. And something that is a hindrance is the geographic variation in maternal mortality based on where someone lives. Black communities see worse outcomes, again, as we mentioned in the social determinants of health section. Finally, at the policy level, something that has helped is the Affordable Care Act has decreased the number of women who are uninsured before pregnancy from 24.4% to 10.1%, and postpartum women who are uninsured from 17% to 7.5%. However, there does continue to be a hindrance in the lack of the social safety net in the United States, particularly around maternal child issues such as paid family leave, insurance coverage, and contraceptive care. So what can be done? Taking a look, I did some research on previous interventions that have been done at the community level that can be implemented from the perspective of a public health nurse. So to begin is a home health intervention that involved 2 public health nurse visits, antenatal, so prior to birth, to mothers in vulnerable areas to promote birth and newborn care preparedness, followed by 4 postnatal home visits to teach preventative care practices, as well as assess newborns for illness and refer sick neonates to the hospital, essentially bringing the care to mothers instead of asking the mothers to come to us to get the education that they need. This could be evaluated for success by the public health nurse assessing the mother for antenatal and immediate newborn care knowledge of danger signs, also the number of women who seek care for neonatal complications, the number of women who seek care for postpartum complications, and whether there is a reduction in maternal mortality. Another intervention is a community health and facility-focused educational intervention. So instead of focusing on mothers, this intervention focuses more on education efforts when it comes to facilities and providers. So the public health nurse provides training to staff at healthcare facilities that are primarily Black serving. Methods of teaching include mass media, individual provider teaching, printed materials, and group information sessions. The teaching is focused primarily around increased recognition of early warning signs of pregnancy, delivery, and postpartum period. This would be measured for success by seeing a decrease in maternal mortality and complications at the hospital facilities where the intervention was performed. And finally, the intervention that I looked at really the most throughout this course is the support group for Black mothers in high Black serving hospitals or areas in which that see high Black populations. So the public health nurse, 2 health promoters, and a nurse midwife would facilitate women's groups for women who are planning on becoming pregnant or currently pregnant and will deliver at the particular hospital that is hosting the group. So these sessions would be at the actual hospital. The groups would meet monthly for health promotion activities, including role-playing scenarios about pregnancy and delivery, nutritional education about folic acid and iron supplementation, touring the labor and deliver facilities, and meeting members of the staff, as well as education about pregnancy, warning signs, safe delivery, and postpartum care. Whether women are actually attending is obviously a key evaluation component, which would be evaluated by looking at the attendance records, taking evaluation of whether folic acid or iron supplements are being taken as they are supposed to, and seeing an overall reduction in maternal mortality at the particular healthcare facilities, which would be monitored via health data of the mothers who deliver at this hospital. A logic model is kind of a great way to visualize how a particular intervention will work. So this is a logic model for that last intervention, the support group for Black women who plan to deliver in high-risk areas or hospital. The inputs necessary are Black women who are pregnant or planning to become pregnant, obviously, the program manager, the 2 health promoters, and the 2 assistive nurse personnel. The program manager would be the public health nurse. Funding would be looked at by local state Department of Public Health, the host hospital, and outside organizations. The activities I discussed previously, so I won't go into each of those individually, but they were in the previous slide. And some outputs that we would expect from these activities that are going to be performed would be mothers feeling safe and supported to experience scenarios among peers before facing real life situations, getting supplements provided at the time of the support meeting, mothers feeling engaged, comfortable, and knowledge of the staff and what to expect during delivery, and linking these mothers to primary care resources should complications arrive. Some outcomes would be faced with similar situations in real life. Mothers would now know how to respond. We'd see better overall nutrition status for pregnant mothers, which of course would reduce the risk of complications, decreased stress during delivery, and early detection of pregnancy complications and postpartum problems, with the overall reaching goal and impact of being decreasing maternal mortality for Black women. As with any public health intervention, there are potential challenges and barriers. I think funding with any public health intervention is a key concern. So this is why it would be important to collaborate with the local Department of Public Health and other organizations prior to the program implementation during the planning phase. This would ensure that it wouldn't present a problem down the road during implementation. This is why we have the community assessment, diagnosis, planning, all the stages of a public health intervention, and it's important that funding is established during the development or planning phase. Systemic racism, I think, would continue to be a problem, unfortunately, so that's why we need to work with stakeholders to explain the reason for the need for these programs, and that Black mothers deserve a spotlight when it comes to public health because of the major disparities that we see. In any healthcare setting right now, COVID-19, I know might feel like we're on the other side of it, but it continues to strain healthcare environments and resources, so it would just be important to create an environment that is clean and sanitized in which people feel safe and all participants wear masks and answer screening questions prior to attending any session or to having a nurse come into the home. So that's a quick overview of maternal mortality in the United States, particularly as it pertains to Black women, and some potential interventions that can be done to help. And these are the references that were used throughout the presentation. Thank you.